Hello all, I'm Eva McGill. I'm the health and driver ed teacher here at Central High School, and I am also certified, instructor certified through the American Red Cross. And so I'm here today for the pre-K partnership, thank you Sarah, to bring to you a little information about Red Cross, and especially about infant and how to deal with an infant who might be choking or an infant who needs CPR. So to begin, a couple of things. Anytime we're dealing with an emergency, so regardless of where we're at or who we're dealing with, the big thing with American Red Cross is check, call, care. So the first thing we do for any emergency is we're going to check. We want to first check the scene. Make sure that the scene is safe for us to enter so that we don't put ourselves in harm's way. It also gives us time to check some of what we think might be going on, so that if I walk in and I see my baby and they don't seem to be breathing, I think maybe they're sleeping, but I can't really tell. It gives me time to sort of check. Do I see something that maybe they are choking on? Do I see something else that's going on that would alert me to that there is an emergency occurring? It's also a wonderful time to get what we call our PPE, which is our protective equipment. So in this case, we definitely want to use gloves. I know that seems a little strange, and if it's your own infant, you maybe wouldn't worry about PPE quite as much. If it's somebody else's infant, if I'm at Walmart and I just saw somebody collapse and I'm going to do CPR on a perfect stranger, I probably want my gloves on. And I'm going to want to have a face barrier. Now this one is just for practicing. There are fancier ones that you can get with keychains and stuff like that. So this one's not really a technical one, but we use it when we're just performing CPR with our mannequins. And what PPE does for us is it protects us from any germs, blood, things like that, vomit, that the victim might pass to me, but it also protects them from anything that I might have that I could pass to them. And in this era of COVID and everything else, the more we can protect each other, the better. So I'm going to check the scene. It gives me time to put my gloves on, gives me time to get that out, gives me time to maybe like breathe a couple of times so that I'm not like all adrenaline rushed. And then I want to check the victim. Okay, so the first thing that I want to do is check to see if they're conscious, if they're going to respond at all. So even if baby is asleep, right, I'm going to tap, but also with an infant, I want to flick the bottom of the foot. I would also yell and be like, baby, wake up, and I am trying to get any kind of response. If I see baby draw its leg back, if it tries to move away from me, if it opens its eyes and cries, I definitely know it's responsive. But we all probably also know a baby who could sleep through like World War III, and so just tapping and yelling may not get any response, but that's why we add the flick of the foot, because it's adding a little pain stimulus, and they should like curl toes or kind of pull away from us if they are just sleeping. Now, if there is no response, now we're in an emergency situation. I would also check breathing. So I'm going to put 2 fingers underneath the chin, and I'm going to put the heel of my hand on the forehead, and I'm just going to tilt the head back a little bit. Obviously on an adult, we're going to bend it back a little bit further, but I'm just trying to get that airway, so get the kind of neck a little bit more straight so that air can more easily pass in. I am going to look, listen, and feel, which means I'm going to get my ear really close to the infant, and I'm looking towards the feet. I'm looking to see if I see the chest or belly rise and fall with breathing. I am listening to hear any sounds of breathing, and I'm trying to feel for any breath on my cheek. If I catch any of those, then those are signs of breathing, and that's a good sign, right? If I don't catch signs of breathing, or if it seems abnormal breathing, if it's wheezing, if gurgling, if the pace is really, really off, then it could still be an emergency. But if they're breathing, then that means I probably don't have to do CPR. But it very well could still be a 911 call. So I check for responsiveness, I check for breathing, and then I would also check for bleeding in general, although I don't know that my infant should have as much of that. But again, If this is just kind of any emergency and we're doing check, call, care, if it's an unresponsive person, then we also kind of do a quick check for any signs of internal bleeding, which would be things like bulges, bruising, or external bleeding, right? So we can see that there's something wrong. If I find any signs of a life-threatening emergency, unresponsiveness is a life-threatening emergency. Baby not breathing or not breathing normally is a life-threatening emergency. Severe bleeding is a life-threatening emergency. And there are others, but then I'm going to call 911. I tell my students frequently, if something occurs and one of your first thoughts is, should I call 911? My answer is probably yes. Because like I said before, I live on Main Street there in Ashcombe. We get kids that ride their bikes up and down. I've seen more than one kid fall off of their bike. And there have been times that I go out and they are crying and they're skinned up their knee and there's no parent around or anything, but is an ambulance popping in my mind because a kid fell off their bike and scraped their knee? Not really. That's called, like, I'm going to clean them up, I'm going to try and get a hold of a parent and get them home, right? But really an ambulance never popped in my mind. If, however, I see that kid fall off their bike, hit their head, they're not responding, they're confused, I'm worried about, like, something along those lines, ambulances are popping in my mind because it's not my kid. I'm not loading somebody else's kid up into a minivan to take them to the ER. That's what the ambulance and 911 call is for. So any signs of life-threatening emergency, we want to call 911. Is it possible that I could get baby breathing and be alert again? Sure. Is it also possible that I don't? And in that case, especially with where we live, the ambulance or police or fire after a 911 call could be here in 5 minutes. It could be 35 minutes. If I start doing CPR on this infant, I don't want to be doing it for 35 minutes if I don't have to. So I want to call 911 right away as soon as I know that there is an emergency, and then I will go and give care. I would also recommend in this day and age, in all likelihood, I'm guessing you're going to call 911 on a cell phone. We could use a landline certainly still, but most of us keep our cell phones with us all the time. And so could I dial 911, put it on speaker, lay it down on the table or next to me, and I can still be providing care while I'm talking to the dispatcher. Keep in mind that if you call 911, you should never hang up on them until they tell you to hang up and they're done with you. And in general, if it's an emergency, they want to keep you on the line. Remember, they've got books and all kinds of information that they can help talk you through what your next steps are, and also making sure that the emergency help that's on its way can find you. So if I can keep my phone active and keep on that 911 call while I'm doing CPR, I can communicate with that dispatcher. The dispatcher communicates with the emergency help. So check, call, care. So I check the scene, I check the individual for responsiveness, for breathing, and for bleeding. We do not check a pulse anymore. We find that the average person really kind of stinks at it, and it's really not necessary. If they're not breathing, then we know that we're starting CPR, and that's the care. So CPR, first off, I'm going to show you how to do it. It is a fairly simple thing, but I'm going to highly encourage that you also, perhaps, if you have never been trained, some of you maybe have been, and this is just sort of a refresher, like, oh yeah, I haven't done that in a long time. Fortunately, because we all knock on wood and hope we never ever have to do any of this stuff. Because doing CPR on an infant does not sound like a good day. If you've not ever been trained and you've never actually done compressions, or you've never actually done breaths, I recommend taking a class. Again, I'm instructor certified here at the high school. I know Sarah's going to post some more information about the possibility of having a class here in the spring. And again, it's, you know, a number of hours to kind of go through the entire course, but it gives you the ability to actually practice and feel what this is, and obviously be more confident if you ever had to do it in real life. So to do CPR, it's a fairly simple thing. So I'm going to go ahead and get my breathing barrier ready, okay? So I'm going to tilt baby's head back, and I'm going to put the breathing barrier on. I'm actually going to keep my hand on the forehead so that I keep that airway open the entire time. I then want to use my 2 fingers, and you can kind of go from armpit, but really you just want to be in the center of the chest. And we're going to use our first 2 fingers, center, kind of upper center of the chest, and we just simply push down in a nice, straight, easy movement. Again, I don't want to push to the side. I'm not like using my whole hand because that's not necessary. Again, infants are pretty flexible, so it doesn't take a whole lot of pressure. And I'm going to count as I go, but I'm going to do 30 compressions. So 1 and 2 and 3 and 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 25, 26, 27, 28, 29, 30. I can keep my breathing barrier on. And for an infant, because mouth and nose and everything is so close together, I don't need to pinch a nose or do anything like that. I just kind of want to make a nice O with my mouth, make sure that I'm pushing down good and hard so that my air goes from my lungs into their lungs. And I keep my fingers on the chest, one so that I can go right back into compressions, but also so that I can feel that chest rise so that I know that the breaths have gone in. So we're going to do 2 rescue breaths, and always make sure you take a nice deep breath in so that you're blowing it out right away so that they're getting the most amount of oxygen out of that breath as we can. Make sure you take another breath between the 2, and we go right back to 30 chest compressions. 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4. Keep going until, well, we keep going until either emergency help arrives. So the ambulance just got there and they're taking this all over. If baby starts to cough, wake up, cry, respond in some way, then we know that we got the heart going again. And an infant CPR, that's a bit more of a possibility than if you have an adult who just went into cardiac arrest because of heart disease. That likely is not going to get the heart started again. We're just sort of keeping their body alive until medical help can get to them. So I'm going to keep going with 2 breaths, 30 compressions until the ambulance or somebody else trained arrives, until I get some sign of response. They say if you get too tired to continue, which infant CPR, I think that would be a while because it's a pretty easy one, but adult CPR is pretty labor intensive, so you could get yourself exhausted, especially if it was going to be an hour before the ambulance got to you. AED, if you have an AED available, which I'm not going to go over that today, but when I go to call 911 or send somebody to call 911, I would also say if there's an AED to go get it. If I'm at home, I don't think anybody has an AED sitting around their house, but if I'm out in public, if you're at any kind of a business, a church, you're at some ball game somewhere, you're at a grocery store, I would definitely be asking some employee for an AED. And if they have that, if the AED arrives, we would pause CPR so that we could get the pads attached and get that started so that that can help assist. If somebody else comes who's also trained in CPR, they could take over, give me a break, or we could even tag team things a little bit, okay? But otherwise, it's 2 breaths, 30 compressions. You just simply keep going back and forth, keeping a nice steady pace with all of it until something changes. And hopefully that is the case. So that is infant CPR. All right. Next up is, so I just got done talking about infant CPR. The next part would be that I wanted to go over was infant conscious choking, which I think is probably statistically a whole lot more common than infant CPR, although if I don't react quickly enough to a baby who is conscious choking, they are eventually going to be unconscious choking. And if they're unconscious and choking, not breathing, what do I do if a baby's not breathing and not responsive? I do CPR, which is what we just did. So conscious choking is a little bit of a different deal. I'm still going to do check, call, care. So I'm still checking the scene, and I'm looking for signs. I'm still checking the infant. This time, though, how do I know that a baby is conscious but choking? And remember, we're using the true form of the word choking, not just sort of like what people throw around. Like, we've all had food or drink go the wrong tube, and we're coughing and hacking and eyes are tearing, and we're like, oh, don't worry about it, I'm just choking. You're not choking. Food went down the wrong way, right? Choking, by definition, means you're not breathing. So you're not able to speak, you're not able to cough, you're not able to breathe. So if we have an infant who is choking, and an infant could be choking on any number of things. We all know that as soon as infants especially become mobile, if they see it and can touch it, it goes in the mouth, right? That's how they discover and explore things, and it's also how things get stuck in their throat and in their airway. So I think a lot of us think food and drink, but with an infant or toddler, it could be batteries and buttons and marker caps and who knows what they put in their mouth and could be choking on. So what if, let's say I walked out of the room and I came back in and I think my baby is choking, or let's say we were sitting at dinner and I had the baby in the high chair and feeding them like real food, right? That all of a sudden, how would I know that a baby is conscious but choking? The big thing is that, remember, true choking is they're not breathing. So they're not coughing, they're not speaking, which a baby wouldn't be speaking, but a baby would definitely be crying if something was wrong. And so they're very silent, right? So when my son was about 9 months old, we were at a restaurant and I had cut up some cantaloupe, which he had eaten plenty of times before. Maybe he was a little older than 9 months. He might have been a year. But I apparently got one that was a little too big, or he got a little too excited, and there he is, and all of a sudden he was choking. So like, it took us kind of a second, my husband and I, and actually my dad and brother, who are also certified in CPR, we all kind of like looked at each other like, is he really choking? Here is how I would describe it. He looked like he should be screaming his full head off. His face was red, his eyes were big and wide, his mouth was open, he looked panicky, arms were kind of flailing, legs were kind of kicking, you could see his belly kind of like doing heave-ho kind of things, and yet he was making no sound. I told my kids if I would have taken a picture at that moment, which would have been completely inappropriate, but had I taken a picture and posted it, you would think he was having the biggest like temper tantrum of his entire life. And you would have thought he was screaming and bothering all the other patrons of the restaurant. And in that case, he wasn't making any noise. But you could tell that something was very wrong, okay? So their eyes are open usually, they're conscious, they're, again, responding. If they were older and would realize something, we would be grabbing at our throat. We would be like grabbing for somebody. I'd be banging on a table like trying to get help because I can't speak. An infant doesn't know to do that, so all they're doing is their little body's trying to clear it out, and all they can kind of do is look panicked and like something is wrong. So we would go over. Fortunately, my son like did a big like heave-ho, and up popped the cantaloupe, and we all went, thank goodness, because about all four of us went to rise to get him at the same time about when he like up chucked it out. And then, by the way, how do you know when the airway is clear? He started screaming his full head off, and like all the other people were giving us looks like, shut your kid up, and I'm like, he breathes, right? Like super excited because he had cleared his own airway. If that's not occurring, then we're going to start with back blows. So you're going to give 5 back blows as well as 5 chest thrusts. It's a little different than a chest compression, but not a heck of a lot, okay? So we're going to start with, I'm going to put my hand around the jaw. So I don't want to be like holding their neck because I'm not trying to strangle them. And I don't want to do what a whole lot of my teenage students do, which is what I call the sucker hold, right? So we are trying to get their airway cleared and we want them to breathe. So covering the mouth and nose is not a great way to do that. So instead, we want to hold the jaw. I'm going to position them so that they're over my arm. Okay, so I've got a leg and a leg and an arm, and I could hold them out here, and again, I'm holding them kind of here so that I'm supporting, but remember, baby is conscious. Arms and legs are flailing. So if I hold baby out, is it possible that baby could like throw themselves off of my arm? Yes, so I'm gonna tuck this leg really nice and close. So I've actually got their legs sandwiched between my arm and my waist, and I'm holding the jaw. I'm then going to use my legs, so I'm just going to kind of bend over, or if you were sitting, right? But you want their head below their butt. So you want head down, and the reason is gravity is going to help us here, okay? So we're going to take the heel of our hand in between the shoulder blades. I'm going to do 5 back blows. 1, 2, 3, 4, 5. Looks fairly violent. We would normally not hit the back of our baby 5 times, but what we're trying to do is kind of jiggle things loose. Again, they're still conscious. They're trying to cough it up. Their body is trying to breathe, and it's very possible that they cough it up, and all I'm doing is kind of jiggling it free, letting gravity help. As soon as they start breathing, you're going to know about it because they're going to start crying because they're freaking out a little bit. If that didn't do it, then I'm going to sandwich the head, so one's on the jaw, other hand goes behind the back of the head, and I'm holding on, and I'm going to flip baby over, so now it's on my opposite arm. I'm going to tuck that leg again. I'm going to use my other leg to help support my hand, because I don't know about your kids, but my kids, when they were infants, were still kind of heavy, so like holding them out was not going to be very well done. So I'm going to tuck and kind of give my leg as support. And then I go a little bit lower than the chest compression, but I'm going to do 5 chest thrusts. So 1, 2, 3, 4, 5. I can look to see if anything's clear, but otherwise, sandwich again, flip, tuck, use my leg, 1, 2, 3, 4, 5, sandwich, flip, tuck, 1, 2, 3, 4, 5. I'm going to continue with 5 back blows, 5 chest thrusts until whatever it is comes out and baby starts to breathe. If baby goes unconscious, then doing this is not going to work. The whole reason chest thrusts and back blows works is because baby's trying to clear its airway at the same time. And I'm just sort of like, again, jiggling things through and using their air to kind of help try to force whatever it is out. As soon as they go unconscious, they go limp, right? They go, think about like your baby when it's in asleep. You know, there's a definite difference between baby awake and baby unconscious. And once they go limp, they're not anymore trying to clear that airway, and so it's not going to be as effective. So as soon as baby goes unconscious, then I'm going to put them on a floor, a table, something, so that I can start chest compressions and 2 breaths, and I'm going to continue with CPR. Or until, again, an ambulance gets there, somebody else. So remember, we still check call care. We're checking, baby's not breathing. Is it a life-threatening emergency? Yes. Do I call 911 in a life-threatening emergency? Yes. Am I still going to give care and do back blows and chest thrusts? Yes, absolutely. But if it doesn't work, again, I don't want to now be like, oh, I never called 911. I wanted 911 to be called 5 minutes ago. And I would like the ambulance people to be here 10 minutes ago, right? So that I didn't have to do this at all. So as soon as we know it's a life-threatening emergency, you need to call, or you need, if anybody else is around that is able to do it, send them to call. Even if that's your 6-year-old, say, get mommy's cell phone, call 911. And you can talk to the dispatcher, they can talk to the dispatcher. If it's an adult, absolutely. You should be providing care. Somebody else is dealing with the 911 dispatcher. But don't wait. I think a lot of times we think, oh, but this can't be as bad as it seems. I'll get the airway cleared. I don't need to bother the 911 call. And like I said, the more time that goes on, the longer the delay before that ambulance gets there to help, or again, police or fire. So call 911 before you provide the care. But if that's not happened, you've forgotten about it or whatever, make sure you call as soon as you realize. It is certainly possible the back blows chest thrust works and we get baby breathing again. it's equally possible that we're going to end up doing CPR and we need emergency help. So check, call care. Hopefully you're never in that position. Obviously, when it comes to choking, a huge part is prevention and making sure that we are supervising our baby anytime it's in a high chair with whether it's toys or food, that we are there supervising, because something like choking can happen in an instant. So I leave my kid, you know, in the high chair, I'm in the kitchen making dinner for the family, I turn around and baby's choking. I don't know how long that's been happening really, and again, it's delaying the care. Obviously picking stuff up, making sure we don't have the little itty bitties, and especially when we have more than one kid, I completely agree that's really hard, because the older kids playing with Legos and you got a baby going around putting Legos in their mouth, right? So prevention is huge, making sure that we're giving them things that are appropriate for them to eat, but also making sure that the area that they're crawling and exploring, that the stuff that they're putting in their mouth is safe for them to do that, so that they don't choke to begin with. Again, it's something that we never ever want to have to deal with, but if we do, then I hope that these two little videos are going to help you to know how to handle that emergency and what care to provide. So thanks for listening. Hope that it helps. Again, if you ever are interested in taking a class through the American Red Cross or through the Heart Association, you can go online or find more information or contact me at the high school, and we're always happy to help. Thanks so much.